Good afternoon. I'm Victor Schaffner, Director of Communications and Advocacy with the University of Delaware Center for Disability Studies, and it is my pleasure to welcome you to the Center's Coping During COVID Lunchtime Learning Zoom webinar. Thank you for joining us. In today's hour-long event, we will be highlighting several tools and initiatives that, during the pandemic, CDS and CDS and its partners created or launched to support the community. We will also be discussing tools and initiatives that are about to be made available to the community for the very first time. Presenting today is Dr. Beth Minio. Beth, in her 13th year as Director of the Center for Disability Studies, will be discussing the Center's newest assistive technology giveaway program designed to empower eligible individuals with intellectual and developmental disabilities. Dr. Sarah Mallory will follow Beth. Sarah is Interim Director of our Center's Health and Wellness Unit. She will discuss new COVID-19 tip sheets for adults and youth, a new customizable document that shares personal health information with first responders, and community training for emergency providers. Debbie Boyer is our Center's Director of K-12 Education, overseeing CDS's School Age Services Unit. Debbie will discuss the Project Delaware initiative, work underway in schools to support the mental health of staff and students, and more. There should be ample time after Beth, Sarah, and Debbie make their presentations to field questions. If you wish to submit a question during the event, you can do so by going through Zoom's chat feature and typing or using speech-to-text dictation. I also want to mention that today's event is being live captioned. Lastly, after today's event, we will email you a brief survey asking you a few questions about the webinar. We ask that you complete it and return it to us this afternoon. Thank you. And with that, I'll turn things over to our presenters. Dr. Minio, Beth.
Good afternoon, everyone. I'm really happy to have this opportunity to share about one of our newest programs, combating social isolation and promoting community engagement through assistive technology, and that's a mouthful. So for short, we call it CSI Delaware. But what this program is at its heart is an equipment distribution program. Next slide, please. Thank you. So I'm sharing on the screen a couple of definitions that come out of research. I don't know that any one of us needs an official definition of social isolation or loneliness because those constructs are all too familiar to us. But social isolation refers to the lack of social connections and participation. And loneliness, of course, is a feeling of dissatisfaction about the level of one's social engagement. The things that you might not know, though, are that these constructs are actually tied to conditions such as heart disease, dementia, other physical concerns, as well as mental health issues. And so these are experiences that all of us have shared during the pandemic. But next slide, please. For many of us, technology has been our lifeline. When we left our offices, there was a way to keep work going through our computers and working in 2 dimensions. We've had opportunity to stay in touch with loved ones and friends through computers and other technology. However, next slide. A lot of people with disabilities don't have access to the same kind of technology. And for them, without those outlets to the world, their isolation and loneliness has really been compounded. And so when I'm talking about technology, I want to clarify that I'm really talking about kind of two separate families of technology. The first, which is represented on the left-hand side of the screen, is mainstream technology, things like computers and tablets, having internet access, having access to products like Alexa and Google Nest that allow you to exert some control over your world and information coming into you. But then for people with disabilities, an important part of access is also often specialized technology, things like communication devices, computer access tools that allow you to interact with a computer with switches, with eye gaze, with other kinds of modified interface technology, things like adapted telephones or hearing assistive technology. And so we have heard over the last year plus now about people really not having access to the tools that they need to stay connected, to stay engaged. And we know the negative consequences that can arise from that. So what I'm sharing with you today, next slide, please, is the CSI Delaware program has been designed to put equipment, mainstream technology or specialized technology, directly into the hands of people who need it. Go ahead. The program is for Delawareans of all ages with intellectual and or developmental disabilities who do demonstrate financial need in that they don't have the means to acquire this technology kind of under their own steam. Next point. So the things that this program provides, it's not just about purchasing the technology and handing it over. It's helping individuals figure out what technology they need by providing either sort of a cursory evaluation or a much more extensive evaluation, matching that person's needs to technology, actually acquiring the technology and turning it over to the person, making sure that all of the components are working effectively together, and then finally providing training to the person and that person's circle of support so that the technology can be used for maximum benefit. Next slide. And so I want to make sure that everyone connected with us today is aware that the Delaware Assistive Technology Initiative, Assistive Technology Resource Centers are once again open for business. We have an AT center in Newark on the University of Delaware campus. We have one in Dover, and our third is in Georgetown. We're open now 2 days a week on a regular schedule, but we can also accommodate people if their schedules don't work with our schedule. But you can come into the center. You don't even really need to know what kind of technology you want. Really, the only thing that's important is that you can let us know what it is that you want to be able to do. We can have these meetings in the centers. We can also work with you virtually if that's your choice. But our assistive technology specialists will show you some products, let you get some experience hands-on. And then if there's a particular product that you think might really meet your needs, help you to connect, help you take part in education, help you to be part of the larger community, then we can lend you that product for a couple of weeks. Just try it, make sure it really is the right thing. And then you can come back to us and let us know, yep, this is what's going to make a difference for me. And we can acquire it and put it into your hands. Next slide. And so I really want to thank the Delaware Developmental Disabilities Council for being the primary funder of this program. They recognized that technology was part of the solution to the social isolation that we're all experiencing now, and approached us about standing up a program like this, and we are so very glad that they did. Next slide.
And so I'm going to be wrapping up my sort of formal comments, but before I do, I want to share the story of our very first equipment recipient with you. This is a gentleman who at one point had an augmentative communication device, and it broke, and his family had no means of getting another one for him. And so, I mean, just imagine during this time not having any um, uh, conventional way of communicating with the people around you. And so in his case, his family's case, they knew exactly what they needed. They simply needed a replacement for a device that was no longer working. And so, as you can see from this picture, which we're sharing with family's permission, he's back in business. And once he got that device back in his hands, he was absolutely immediately back in business and was very happy about it. Next slide. So I want to let you know we have applications available on our website for download. The web address is www.cds.udel.edu/AT/giveaway. We can also mail you an application if that would work better for you. We also have applications available in Braille, in large print, and also translated into Spanish. We have someone on our staff, her name is Allison, who is really the manager of this program. And Allison is available to provide as much support as you need in understanding the program, in connecting to our AT specialists, and to walking you through the entire process. So we hope that you know someone, maybe it's you, maybe it's someone in your family, or maybe it's somebody you support who might be able to benefit from this program. Please connect with us. Please let us know how we can support you in getting your hands on the technology that will make a difference. Thank you.
Thank you, Beth. We do have time for some questions, which we have. Is this also for assistive technology which promotes independence?
Well, I'm not sure what you mean if you have a particular type of technology in mind, but it really is intended to help people connect with the outside world, maintain those connections, and engage in the activities that they enjoyed before they were isolated.
You also mentioned financial need. Can you be a bit more detailed insofar as what is required? How can somebody be eligible?
Sure. And so we are determining financial need based on federal poverty levels, and our guideline is when families are income cannot exceed 200% of the federal poverty level. The thing that's important to remember is that that level changes based on the number of people in your household. And so as part of our application materials, we have a table that lays all of that out. And so you can very clearly determine whether you're eligible under those terms.
Okay. Is there a limit to how many items a single person can obtain?
We have not placed an upper limit on that. I recommend that you get in touch with us through Allison, and we can talk to you further about your needs. But our primary interest here is helping people connect in all of the ways that folks did before the pandemic.
Okay. What if I cannot make it to one of your AT resource centers? Can I sample or get trained on the assistive technology in my home?
That's a very good question. Again, get in touch with us and let's talk through the particular parameters we want to problem solve with you.
How long will this program be available? Will it be available beyond the pandemic?
Our current funding takes us through September, the end of September, or until the funding runs out, whichever comes first.
And last question, are people eligible if they've already benefited from some of CDS's other giveaway programs?
Absolutely. As long as the person has an intellectual and/or developmental disability and meets the financial requirements, then it really is not relevant whether there has been other interaction with our AT centers in the past.
Okay, Beth, thank you very much. And now we will turn to the next segment of our program to Dr. Sarah Mallory. Sarah.
Me here today. My name is Sarah Mallory, and I am here to talk to you about our COVID resources that we've been working through. Before I get started, I wanted to take a moment to thank the members of our team who've been contributing to this. Besides myself, there's Pat Heineman, who's been an amazing resource in finding out every possible thing there is in Delaware that we could offer and support in these resources. Victor, who's part of course, our amazing communication team and has helped facilitate the development of these materials by leveraging an interdisciplinary team to work on our accessibility and make them look beautiful. And then of course, Brittany Powers, who actually launched this work earlier this year. So I'm going to talk a little bit about how we landed to complete this work. So on the previous page, you saw that this was a partnership that is occurring between the Center for Disability Studies and DDC. And it was based, it emerged out of the beginning of the pandemic, when we were first really finding that there were significant needs of our community. And so in order to better understand those needs, we conducted a needs assessment. And we completed community presentations, we interviewed folks, we had roundtable discussions. And from all of that work, what really emerged was several themes about the areas of need that folks were really facing around behavioral and mental health, access to healthcare and needed services, specific needs of children and families with young children, and then social determinants of health, which usually relate to things like food security, housing, transportation. And really, this is very consistent with national data that we are seeing, and that we know that the pandemic is highlighting these really systemic problems that's always have really existed underneath the surface. And specifically has highlighted health disparities that individuals with intellectual and developmental disabilities face every day. And so based on this information and based on this needs assessment, we decided to have 3 layers of response. So our immediate response relates to COVID-19 and the needs that we are seeing right now. And that is through what we call our COVID tip sheets. And so that is kind of our immediate response. Our next level of response is more of a medium length goal and something that we want to continue to develop and bring out further. And that's something called the My Emergency Care Plan, which I will be sharing with you in a moment. And then our final is really looking towards making a systems level impact. And that was through the development of a community-based training for emergency providers. So beginning with our COVID-19 tip sheets, this was, remember, our first level of response. It's meant to respond to the immediate needs that individuals are facing right now. We have 2 versions of it that are one that is geared towards youth and one that is geared towards adults. And one thing that was very important to us from the beginning is we wanted to make sure that these were Delaware specific resources that individuals could put their hands on and have readily accessible to them. And so we had to work hard to essentially resist the temptation to kind of put some of those national things that maybe wouldn't be as helpful to somebody in this moment who's living in Delaware. We structured the different components of these tip sheets around the areas of need that we identified and the themes that we identified from our focus groups and our needs assessment. And then we worked on these in collaboration with both the DD Council as well as other community stakeholders. So we were constantly refining the list and the materials and the resources that we were including on here and making sure that they were useful to the community whom we were trying to help. And one thing to note is that we are making them available in both digital and paper formats. So I'm going to slide off of my PowerPoint for a moment, and I'm going to show you what the tip sheets look like. So we have, as I mentioned, two different tip sheets. They are one page front and back, and we are looking at the digital version right now. It is the youth version, so you can see it has a lighter blue, and our adult version is a slightly darker blue. And these are meant to highlight different resources that are within the state that are most useful to different youth who might have intellectual and developmental disabilities or disabilities in general and are needing resources during COVID. You can see that it includes anything from information about the vaccine to meal plans that are available, as well as information around basic needs and health. All of the materials that we have produced are fully accessible, so both in digital and paper format. So we know that as we push these out, folks are going to be able to access them using their screen readers and being able to look at them on paper format as well and have it be very accessible to them. You can see also that the adult version is quite similar, but the resources again are geared towards adults with disabilities rather than youth with disabilities. Part of the reason why we did this is that there was an enormous amount of resources that are available in the state. And we wanted to make sure that when somebody is looking for something, that it could be a quick reference and that it was most useful to them. So that was our COVID-19 resource tip sheets, and those have just been finished and are going to be released next week. So as part of enrolling in today's webinars, we will be sharing those with you first next week as we push them out. The next layer of response is what we call the My Emergency Care Plan. Now, this was something that really was coming out of those health disparities and those systematic problems that were emerging from our focus groups that we ran, and specifically identifying that many emergency room providers are unfamiliar with best practice and evidence-based supports that should be used with individuals with disabilities. So we, again, have created both a paper and digital version of this plan, and it's designed to promote both self-determination and independence from the point of view of the person with a disability, as well as provide a quick reference guide for emergency room staff in order to be able to know the unique needs of this person. It highlights things that are important, such as the characteristics of like communication, how somebody communicates, what devices do they use, do they have equipment that's important, are there sensory differences that the person experiences that might impact the quality of care that they are able to receive. It's also is designed to really be for two users, both for the person with a disability who is completing this and being able to share this with healthcare providers, as well as the consumer on the healthcare provider side who's going to be looking at this resource as a quick reference. So the My Emergency Care Plan begins with a cover sheet introduction that introduces it to the person, gives them directions. And also, I want to take a moment to highlight one important resource of it, and that it gives information about advanced care directives. This was something that we wanted to make sure that we were able to offer for the person who's filling it out, because that's often something that's asked in hospital settings. And a lot of people don't really necessarily understand this. So we worked with the Disability Law Program and the Community Legal Aid Society to have their reference and their contact information included on here. So as a person with a disability is filling this out and completing this in advance of emergency, to bring with them in case they experience an emergency, they are aware of this kind of information before they find themselves in a crisis. In addition to the cover page, we have the plan itself. And this is the digital version of the plan. And of all of the resources, this is my personal favorite because you can complete it as in a digital format and then print it out. Or more importantly, you can save it as a PDF and it will be on your phone. And so that allows you to have a very transportable version of all of this critical information about yourself as a person with a disability that you will be able to share with others. And so all of these boxes are fillable. You can just type right into them. And you can even upload a picture of yourself by clicking right here. Oh, no, I had a sample ready that didn't show. But just like any other form, you click on it and it loads the picture for you. There's also a couple really important features to note. You can see on the front page here, only the most critical information is included. So we have under My Conditions, a place where somebody can describe their disability and their health conditions. And more importantly, a place where somebody can highlight very important features. For example, we were discussing if somebody had a fused spine and they have to be careful when being moved, that's where that information can go, because that's going to be critical to providing safe care to that person. We also include in here how the person communicates. So all of these boxes, you can check multiple boxes, and it also allows the person to share if they use multiple modes of communication. So we have this very critical first page, and then we have what I kind of call a table of contents that outlines some of the other important features of it. I'm not going to show you every page, but I do want to highlight a few parts that we find most useful. First, we have the whole medical profile that talks about equipment and devices. And then it also includes an opportunity for somebody to know ahead of time which immunizations they've had. So the types of things that might be hard to recall on the spot or even communicate on the spot, a person with a disability can fill this out in advance and bring this with them to an emergency room situation. One part that I really like are these buttons. You might notice that there's a number of buttons that are around that say add more information. And if you click them, what happens is another page of that same page appears. So this is done for two reasons. One, many folks with disabilities might have very complex medical needs. And so this is a place where you can really expand out the list of medications, for example, as much as you need. However, we also didn't want to have extraneous pages in there. So if a person maybe does not take many medications or any at all, then we don't need to have blank pages included. So it's more efficient for both the physician who's looking at it as well as the person with a disability. Finally, I just wanted to also note that we have information about the Advanced Care Directive, as well as really what I consider some of the critically important information about things that are going to support the evidence-based care and the safe care of a person with disability. So things of how I express myself, maybe when I'm anxious or stressed, or if I have sensory differences, what that might look like. And we even include things like for thinking about if the person has a service animal that might be at home, alerting the hospital staff that that's there, so that way steps can be taken to make sure that the animal is cared for. And so it's a very interactive document. As you can see, you can fill it out and then print it and have a paper copy, but then also have a digital copy that's available on your cell phone, which sometimes people are more likely to grab a cell phone than they are a piece of paper. We also have a paper version, so if somebody does prefer to fill it out by hand, it replaces the boxes with lines instead. The final component to our work is really going towards causing more systemic change and helping to improve emergency care providers' understanding of people with disabilities. And that is through a community training. And so the community training is specifically focusing on intellectual and developmental disabilities in emergency care situations and helping to raise providers' awareness of the different needs of this population in a hospital setting and beyond. We went through the Medical Society of Delaware, and we were able to have it be approved for CME credits. That's continuing education credits. So not only is this going to be really helpful for providers to take, but then also there's an added incentive that they can receive CMEs for it, and we're offering it for free. So there's a number of benefits to it. And it's going to start off with having a small, short didactic component that talks about the core characteristics of individuals with intellectual and developmental disabilities, and best practice for evidence-based care. But really the highlight of it is going to be a panel that we wanted from the very beginning to be comprised of both medical staff, a self-advocate, and a family member. So the training is registration for the training is currently being uploaded, and it's about to be sent out again by the Medical Society, but we know that it's going to be scheduled for June 3rd. And it's not just open to medical providers, it's actually free and open to the public. Anyone who's interested can attend. You just have to register through the Medical Society's website. And so when we send out our materials, we will also make sure to share that information with you as well. But I also wanted to take a moment to share who's going to be on our expert panel. So like you heard me mention earlier, we wanted to make sure that we had a provider, a self-advocate, as well as a parent member. And so Dr. Wright is going to be representing providers, and Emmanuel Jenkins, who is going to be a self-advocate and talking about his experiences. And then also Dr. Schrader is going to be there. And Dr. Schrader, we're very excited to have because he is also an orthopedist at AI DuPont, but he's also a parent of children with disabilities. And so he and his wife are very active in the community. And so they are able to speak to wear multiple hats when he presents. So I will stop my share, and I see questions popping in, so I'll let Victor filter those.
Sarah, thank you very much. So let's try and get at some of these questions. So regarding the My Emergency Care Plan, I am worried about privacy. How does making all this personal health information available protect my privacy?
That's a great question. So I think it's important to remember that you have full control over how this information gets shared. So it is not getting loaded to a database. It is a document that you hold that is yours, no different than any other type of almost like a Word document or something like that. So if you choose to complete this, it's only saved on your computer. It doesn't go anywhere else, unless you choose to put it on, have a copy saved on your cell phone or have a paper version that you can share to others.
Okay. Also about the emergency care plan, it seems like a lot of information that you're requiring. What if a lot of it is not available?
That's a great question. And I think that's where we tried to be as thorough as possible and think about all of the various needs of different people with disabilities. And given how customizable a lot of the sheets are, that additional components can be added or as needed, then it can be very much customized to the user and what they feel most comfortable sharing.
Okay. If your health network like Christiana or Penn Medicine already has a lot of this information, is this form really needed on top of the information they already have?
So I think that a lot of this form is actually coming directly from what we were hearing from the needs assessment, and many folks saying that they were showing up in emergency room situations and they weren't able to accompany, the caretaker may not be able to accompany a child for whom they care for, or that they would come in and many providers didn't have it. On Wednesday earlier this week, I was sharing this with some folks, and many of them were saying how helpful this would have been for to use also with first responders. So it gives some information. And while the document is thorough, having the table of contents, if you will, that the page reference makes it a quicker reference guide.
Yes, about the thoroughness of it, somebody asks, do people in emergency departments say or have a concern that an 8-page or 6-page document, however long it is, might be a bit long?
Yeah, and I think that's where having the reference pages is very helpful, and also folks with whom that we've shared it with, both providers is who's one of our consumers, and then also people with disabilities have both kind of felt like the content was was capturing some of those areas that they otherwise would not have known about.
About the tip sheets, the COVID tip sheets, Sarah, are they available in Braille or large text?
Right now, they are not, but we are also, this was our kind of first round of materials and are looking for forward to actually building off of them and offering it in other forms as well.
And lastly, also about the tip sheets, when you typically call agencies or even some large nonprofits for help, it's hard to get routed to the right person or even to a real person.
Mhm.
Looks like with some of your resources, I might encounter that same problem.
Yeah, so every single person that, or every single agency rather, or organization that we included, we personally called them ourselves and also and discussed what would be the best point of contact for them, and included the information that they gave us of what would be the most efficient way of connecting with folks.
Okay, Sarah, thank you very much. And now we are going to move on to our third presenter, and that is Debbie Boyer. Debbie?
Thank you so much. So we're going to kind of change context, and I'm going to talk about our response to support schools to address mental health needs during COVID. So I'm going to try to quickly touch on these broad topics, and I'll be explaining a little bit more in detail as we go along what some of these things mean if you're not in the education field. So one big idea is, how do we really embed mental health supports in the whole school system and structure, and ground that in what we're doing at Tier 1, which you'll hear more about, meaning what at Tier 1 is access all students have to those resources and materials to support their own social and emotional development and growth and needs. And then the last piece I'm going to touch on is effective use of data broadly, but really hone in on something called universal screening. And we see right now there's a lot of interest in universal screening for mental health needs. So even if you're not in education, you may be hearing about this. So I'll give you a little bit of background on what that looks like. Next slide, please. Oh, and one moment, you don't have to go back, but the visual on this slide, there's several hands on top of a globe. And for me, this really represents everyone coming together, my whole team at the center who's been amazing through COVID, and the partners that we work with in the districts to really figure out how to respond to the mental health needs of students and staff during COVID. Thank you. And I definitely want to make sure to thank the Delaware Department of Education, who supports this project and is our partner in our work. The one project I'm going to talk about is the Delaware Positive Behavior Support Project, or PBS. You'll hear it's also referred to as PBIS, Positive Behavior Interventions and Supports, but all of those are multi-tiered systems of support, MTSS. And MTSS is kind of the new term that most people in education are using now to talk about how we think about providing supports in academics, as well as for social, emotional, and mental health needs. Next slide, please. Victor mentioned this is also related to another project that we have called Project Delaware. And we partner with DOE on this project, as well as the state's Division of Prevention and Behavioral Health. And this is a federal grant that the state received. We're actually 2.5 years into the grant, but this grant was really focusing on mental health, wellness, and resiliency supports in schools. So in many ways, we were really engaged in this work before COVID hit. And as I think Beth alluded to, one thing that we notice about maybe a silver lining of COVID is that it's raised awareness of others outside the disability community of things like, social isolation, loneliness. It's also raised awareness of mental health needs, because, in many ways we all experienced a collective trauma to some extent or other related to COVID. And so the ability to talk about social stresses, emotional stresses, anxiety, trauma because of COVID is much higher now. So I feel that it's provided some focus and attention on mental health that we didn't have when we very first started this project 2.5 years ago. Next slide, please. I'm going to share a video in just a moment, because this video comes from our national PBIS partners, and it explains something called the Interconnected Systems Framework, which was work that we were beginning to engage in with Project Delaware, that looks at how do you actually embed mental health supports. But I think the video, it's only 4 minutes long, and it does a nice job of contextualizing this issue nationally, as well, which is very much a reflection of what things look like in Delaware. And we'll give a little bit more of an explanation of MTSS and PBS. So I'm going to ask that the video be pulled up and played. And as I said, it's only about 4 minutes long.
It has never been more clear that we need a new response to meet the mental health needs of our youth. The social, emotional, behavioral needs of students has never been more prevalent in our country, and the need continues to grow. Suicide has gone from the 4th leading cause of death to the 2nd leading cause of death among youth and young adults. 1 in 6 youth experience a mental health disorder, and only about 50% of those youth receive treatment. Lack of student access to treatment leaves schools as informal mental health providers, which is okay because school mental health research says youth are more likely to complete treatment when offered in school settings. The increasing need of our youth and communities makes it time to break down silos of service delivery and focus on a whole population response. Schools have been using a prevention-focused tiered logic known as PBIS to organize and allocate resources to support behavioral needs of students for decades. And school-based mental health has grown during this time period as well, while powerful and more effective to have supports within the schools. Often, school teams and community partners still work in isolation, not knowing the supports the others provide. The Interconnected Systems Framework draws on the strengths of both systems to create one single system of delivery, while also focusing on increasing the confidence and competence of all school staff to rigorously and continuously support the mental health of all youth. Before we provide enhancements to the current systems, we first need to celebrate the progress that has been made. Through the advancements of both school mental health and PBIS, we are at a tipping point where mental health and wellness for all students, staff, families, and communities is a top priority. There is awareness and even support and policy for increasing mental health clinicians within schools. SEL is being prioritized and taught like academics to all students by all staff. There is increasing awareness of childhood trauma and understanding of the impact on learning. While these are huge celebrations, there is still work to be done. Now we need to move our focus to designing our systems to integrate these successes in the most efficient and effective ways. First, we must alter our systems so that we utilize the social, emotional, and behavioral expertise of school and community clinicians on teams, who are selecting evidence-based practices together that align with the need of the community, the resources available, and the capacity to implement. Then define one continuum of supports matched to the needs of their students, families, and staff, and use data to drive how students enter and exit interventions, helping move away from a traditional referral handoff approach. Integrated universal teams can focus on prevention by using data to expand and prioritize the social, emotional, behavioral competencies being taught to all youth, and align the skills within systems such as our school-wide matrices to create consistency. Then integrated teams create procedures and structures for routinely monitoring all practices that are put into place to ensure the end result impacts student outcomes. We also must invest in the time, space, and coaching for teachers to embed social, emotional, and behavioral teaching alongside academic content. Sustainable change comes from systems change, and the ISF provides the structure and processes to enable this change to occur. If you are ready to begin an integrated way of work, see video 2 for an introduction to using the tools and resources available within Volume 2, an implementation guide.
Thank you. So hopefully you get a sense of what we mean when we're thinking about an interconnected systems framework. But I want to highlight something that's very different and something that's concerning to us right now that we hear a lot of people say is that what we need right now are more counselors or clinicians in schools, and that is a critical piece of our response. But if we simply add more counselors and clinicians to schools, we're not actually going to change the system, and we're not going to have the impact that we really want. Because what often happens in our traditional world in schools is that a student is sent to see the counselor, and only they provide the mental health supports. And it's not really tied to what's happening in the classroom. And you can imagine how much more impactful it would be if everyone in the building saw mental health and social emotional supports as part of what they do. And that when students need more deeper, intensive, individualized things, those resources are there, but they're not kind of an add-on without being part of the whole structure. So I think of it like universal design. If we build the building from the start so that it's accessible to everyone, it's so much more thoughtful and useful than if you simply add an access ramp after the fact. So we want to think the same way about how we're thinking about mental health in terms of implementation in schools. Next slide. And that's really a key message. This slide just shows a visual of some of the things in the videos, but I really just want to highlight the point that mental health is for all, not just some people, but all of us, adults and students. Mental health is an important aspect of all of our lives. Next slide. PBIS, which developed the video you just saw, the National Technical Assistance Center, also developed this guidance document called Supporting Schools Through Phases of Crisis Recovery. This didn't come out right away, but we were very happy when it did a couple months ago because it really validated a lot of how we were approaching our supports to schools in terms of using existing structures and really prioritizing what we were doing at Tier 1, meaning for all students. Next slide. So this is a visual. I'm not going to go into this. The details don't matter, but I just want to point out that in terms of the phases of recovery, this shows there's 4 phases: your immediate crisis response, your initial recovery, intermediate recovery, and then enhanced implementation. Most of us, our schools are past immediate crisis response. Next slide, please. And they're really in, this pops out that initial recovery second phase that visual showed. Interestingly, when we asked our district PBS coaches at a meeting just a few months ago where they felt most of their buildings were, people really said in this initial recovery phase. This document shows kind of what are the most important actions if you're in that phase, and then aligns resources that you can access in your building if that's where your school is right now. And it's sort of broken out between whether you're just getting started with MTSS or PBIS, or whether you've had that and you're maintaining and strengthening those supports. But you might notice if you're in initial recovery and you're just getting started, the very first point on here is to prioritize staff wellness. And that was something that was very important to us when we began to look at this, because we realized, the age-old message that they use in the trauma trainings is if you're in an airplane, the very first thing they say to do is, if you're traveling with someone that needs assistance, is put your own oxygen mask on before you help someone else. And this was very much in line with that thinking. If we were not helping care for the staff who were also going through this, they were not going to be able to help the students. And also, they were not going to be good models. So we have to empower the staff to understand how to take care of their own mental well-being and wellness, and therefore better support the staff and model what that looks like. The guidance document has many national resources, but what we did was we took this and we aligned it with hyperlinks to resources that we had developed in Delaware. So our schools have access to something that's from the national PBIS, as well as tools that we created, throughout this last year or so in response to COVID. Next slide, please. There were several coaches, though, that felt their schools were in this intermediate recovery phase. And in this phase, you might notice this is where you begin to think about looking at your data. And if you already have practices where you're effectively utilizing data that you're already collecting, then to begin to think about enhancing your screening protocol. And that was that universal screening process that I'm going to mention in a minute. And once again, there's specific resources that are linked to this document that if a school is in the intermediate recovery phase, they can access tools that are best aligned to their needs of where they are in the recovery process. And I should also mention that, it's not necessarily linear. As we've seen this year, we can go up and down in our recovery crisis response phase at any point in time. So schools can move back and forth between the phases depending on as issues arise throughout the year. Next slide, please. So these are a couple of the Delaware specific things that we developed that they can link to in that document. And we also have available on our website for educators. The first one I want to touch on, next slide, is one of the earliest ones we did was using MTSS, so using your multi-tiered system of support to keep social emotional learning a priority for return to school. So this we did, it feels so long ago, but it was so last June, we rolled this out right when people were beginning to think about, oh my gosh, what's return to school going to look like? How am I going to meet everyone's needs? And a partner national agency called CASEL, which is the Collaborative for Academic, Social, and Emotional Learning, had come out with this tool. There's an image on the slide of the cover page, and it says, leveraging the power of social emotional learning as you prepare to reopen and renew your school community. And something else that we noticed during COVID is that educators were flooded with resources. And it often felt like people were overwhelmed and thinking, oh my gosh, now I have to do this new, totally different thing. And I don't know how to do that. This is so different than what I was doing before. And so we wanted to make sure that people used what they already knew, their existing multi-tiered system of support structure, and connected the new strategies to that. So that was really the focus of this webinar. And we did get some feedback from people after they attended, educators that felt like, okay, I can do this. This makes sense. Next slide, please. These are the specific critical actions. And just because of time, I'm not going to go into a lot of detail, but this is where we said, okay, in your MTSS system, what does it look like to provide opportunities for adults to connect and heal, that staff wellness? The third bullet, creating emotionally and physically safe, supportive, engaging environments, that's kind of our happy place in PBS. So we simply reminded people, you know how to do this, but you might need to do it a little bit differently now that there's virtual learning, hybrid learning. Take what you already know and tweak it so that it addresses the current context. Next slide. These are a couple of classroom examples, but like I said, I'm going to go a little more quickly because I know we want to leave a little bit of time for questions. So if you could go one more slide. Something that with Project Delaware, one of the key components of that project was to provide access to additional mental health services for students. But when in the earlier stages of the pandemic, the clinical staff that were hired for this grant were finding they were not getting referrals to see students for a myriad of reasons, but staff were having a lot of problems. So one of the things was they pivoted and they provided mental health supports to staff in the early days of the pandemic. and created resources to promote self-care to staff as well as families. So that was an adaptation that was made very early on. Next slide, please. We also took our behavior matrix, which you saw in the video, and again, created examples for educators about what could that look like in terms of defining what students need to do to be effective learners and to address their own social emotional needs, whether they were learning, virtually, whether they were returning to in-person or a hybrid context. And we gave specific examples that people really liked because they were able to tweak those and didn't have to start from scratch. Next slide. I'm not going to go into the examples in detail, but I do want to mention that this slide just shows a graph which has 3 school-wide expectation examples like responsible, respectful, and safe, and then what those look like across settings. We also asked people to really highlight the final column says mental wellness. So what does it look like for a student to be responsible for their mental wellness, for example? And that was important because we wanted to make sure that every teacher was very explicit about what that could look like in the classroom. So it wasn't, as I said, just the counselor who was talking about this, but every teacher was teaching and providing a specific support to every student in the school. Next slide, please. You can go to the next slide. Oh, thank you. The other thing, we had we created a webinar on effective classroom practices. Oh, that's my timer. So I'm glad I set that. Can you go to the next slide? I feel like it's, well, maybe this, Ed, go ahead and go one more. Maybe this is a sign that I should just stop talking. Because it's, okay, great. I wanted to mention the universal screening. So we have a webinar online that educators can access that kind of answers the top 10 questions about universal screening, which, as I said, this has gotten a lot of attention because people are saying, well, we really need to kind of screen every student for mental health needs. And while that is an important consideration, we don't want people to rush and just implement a screener without being really thoughtful about what goes into that and not forgetting existing data sources they already have and should be using. So if you go to the next slide, one more slide. A lot of schools, oh, sorry, it's just there's some lag time for whatever reason, so I apologize for that. But something I wanted to mention, that all schools are collecting attendance data right now in some version or another. And often attendance data in this context can be a sign of other social or emotional needs. So we want schools to pay attention to the existing data they have and to think about it in the context of COVID. So meaning if a student's not engaging in their online learning, instead of just saying, well, that student's not behaving in the way I want, try to understand and think about what might be the dynamics as to why is that student not engaging in online learning, and investigate that further. So it's not until you're looking at the data you already have that we really recommend considering adding another tool that would identify additional social, emotional, or behavioral support needs of a student. So I actually think that's probably, because that was the last piece anyway. The only other thing that we are offering that's kind of related is the Delaware School Climate Survey we do every year. We offer every year district-wide. We still have 131 schools participating this year, which we were really happy about because we weren't sure if people would want to do this. Normally we have about 140 to 150, so it's pretty close. But we did make a couple of changes to the survey to reflect COVID times. So we added a question to ask what's the learning context for the students, so we can look at the data if they're learning virtually, if they're hybrid, or if they're fully in person. And we took off some items that kind of didn't make sense for the COVID context. So that will be interesting to take a look at. And as I said, I think this is probably a good time to maybe pause for questions. Next month is Trauma Awareness Month, so I do want to put a little plug in for that. Tomorrow kicks off trauma awareness.
Debbie, thank you very much. That was a lot of material that you ran through in a short amount of time. We are coming up on the top of the hour. I just want to mention to our audience that we will go a few minutes past so that we can ask some questions of you, Debbie. So are you finding that underserved or minority populations, students from these populations, have suffered more acutely during the pandemic regarding their mental well-being, and what's being done in the schools specifically for those individuals?
That's a great question. And I would say from what I've seen or what I'm hearing from our district coaches, definitely. Our grad student actually just did a project in the district she's placed in. She's a school psychology student that looked at attendance by zip code and attendance rates for students from zip codes where, you know, based on my knowledge of that zip code, families' socioeconomic level was lower than other areas, had significantly higher rates of missing school. And so the district was really looking in that and trying to understand why are the students, you know, as I said, not logging in or not coming to school, and how can we better support them? So not kind of punishing them for missing school, but, you know, reaching out to students and families to try to see what supports they need to be able to be effectively engaged in schools. We're also partnering with the districts right now on specifically around culturally responsive practices related to equity. So that is a big need that our district folks have shared with us, and a priority for the Delaware Positive Behavior Support Project right now. But very good question.
Okay. What you and the schools are doing is really ambitious, but our budget constraints tied to the pandemic making it hard to deliver on the scope of this work concerning mental health. On the flip side, you actually mentioned that educators have been flooded with resources.
So yeah, I actually think it's almost the opposite problem right now, where everybody wants to give resources to schools, and in a way that sounds good, but it creates its own set of problems, because if you don't know how to effectively utilize those, trying to do too many things and not doing them, any one of them fully, can sometimes be worse than doing a few things and really ensuring that they're done with fidelity. So my fear would more be, because there's so many resources, both tools and funding right now, but that's not necessarily long term. What's going to happen, you know, say in 2 years, when the additional funds that were provided related to COVID go away? That's kind of my concern, and why I think we need to focus on what are the systems and changing the systems now, so that we can really advocate and track the impacts those resources are having, so that we can advocate for keeping them long term. So it's a really good question. It's just, I almost see the opposite right now, with so many things being thrown at schools that they can't always make good use of them without thoughtful attention to the systems needed to implement.
And also, Debbie, how will your work fundamentally change as students and staff increasingly return to the classroom?
I think our work, kind of fundamentals of our work, will stay the same. So we'll try to adapt our resources and tools to the current context. So I think what we're gearing up for this summer is really helping people prepare for return to school. There will be, we're imagining a kind of a significant adjustment. You know, not all students have been in buildings. thinking about what those routines look like. So again, taking the same tools that we tweaked for the COVID response, you know, in terms of rethinking of what they look like virtually, really focusing now on what should we be paying attention to as students return to school. We always say you should actively teach expectations, you know, at the beginning of school, but now maybe take even more time to teach expectations and to give students time to process their experiences, and staff too. I would say probably what will change is I think we'll be needing to spend more time with understanding systems that support staff return as well as students.
Okay, this hour has sped by. I want to thank our presenters, Beth Minio, Sarah Mallory, and Debbie Boyer for spending all this time and providing all this information to everybody today. I also want to remind everyone who has tuned in to today's lunchtime learning event that we will be sending you a survey. And again, we encourage you to please fill it out, send it back to us so we can learn about what you took out of today's event. We also want to let you know that by virtue of your having signed up for today's event, that you will also be on our mailing list to allow us to let you know about future events that our center will be presenting. And with that, I want to thank each one of you for joining us today on Zoom and wish you a pleasant afternoon.